trend that is affecting all businesses across the country next year is healthcare. And healthcare costs will change significantly after next year's. I mean, it's not a big deal, right? I mean, it's only like what, like one or second or third biggest line items on our P&L. It's only the most requested benefit by all of our employees. It is only one of the things that we have to retain, to be competitive with other businesses, to have good competitive healthcare without going out of business or exceeding costs in the meantime. Healthcare costs themselves are a significant cost to our companies, and they will change after 2020. Now, some clients ask me, does Obamacare actually still exist right now? And the answer to that is that Obamacare actually does still exist. I mean, right now, if you're running a company with more than 50 full-time equivalent people, you are still required by law to offer affordable health care to your employees. The Obamacare exchanges have about 12 million people enrolled on them, although many of them have seen their exchange premiums doubled since 2014. And there were two big things with Obamacare that's still around and will likely still continue to be around for years to come. One has to do with pre-existing conditions. You cannot buy an insurance policy that does not allow you to cancel your insurance policy just because you have a pre-existing condition. And of course, if you have kids up to the age of 26, you still get coverage. All of that is from the Affordable Care Act going back to 2010, and all that is still in existence. But just because the Affordable Care Act is there doesn't mean that the Trump administration has been doing its best to chip away at it. So the Republicans tried to repeal the Affordable Care Act back in 2017. They failed to do so. So what the Trump administration has been trying to do is offer more options to business like ours and the companies that we advise. So for example, they did repeal the individual mandate. As we know, we're not required by law to have health insurance anymore. But now businesses are allowed to offer what's called skinny plans, which are lower cost, lower benefit plans that are still, before under the Affordable Care Act, were not allowed, but now the Trump administration is letting them there. They're not very good plans, but they're plans that are less expensive. And they're an option that you can provide to your employees that will provide them with coverage. The Trump administration is now, starting January 1st of next year, will be allowing healthcare reimbursement accounts. I will be talking about that in a minute. They are now allowing association health plans. I'll be talking about that in a minute. And in addition, recent executive orders from the Trump administration are basically saying that we want more transparency from hospitals and from drug companies. We are reducing funding for education and marketing. For example, right now we're in an enrollment period for the Affordable Care Act and the exchanges, and that information is not as available as it was, say, 4 or 5 years ago, because the administration has cut back on the education funding. The administration has reduced funding for insurers for certain low-income customers, and they're trying to expand the use of private insurers and private healthcare providers in Medicare as well, all providing different options for both individuals and businesses. As we head into the end of the year and we look at the Democratic candidates, Bernie Sanders and Elizabeth Warren, as we know, support more of a national health system initiative and Medicare for all. It's debatable whether or not that is a good thing or bad thing for individuals or businesses themselves. Joe Biden, the third of the big three, wants a full restoration of Obamacare. So if we see him being elected, we will see going back to what it was back in 2010 is what he's looking for. All three candidates do support some form of Medicare for all. Their various candidates have different ways as to how they want to pay for it. Obviously, some of those ways are debatable, but you can see, depending on how the elections turn out in 2020, there will be some big changes to how health care is provided and paid for in the future.